COVID-19 is a disease caused by a virus known as SARS-CoV-2. It belongs to a larger family of viruses called coronaviruses, which also include viruses that cause the common cold. This new virus was first identified in December 2019 in the city of Wuhan, China. At first, the outbreak seemed small, but within weeks, more and more people started showing symptoms: fever, cough, tiredness, and in some cases, trouble breathing. Doctors discovered that the virus was spreading from person to person, mainly through droplets in the air when someone sneezed, coughed, or talked. Unlike many other viruses, COVID-19 spread extremely quickly. Some people had only mild symptoms or none at all, but they could still pass the virus to others. This made it difficult to track and control. What made COVID-19 even more dangerous was how it affected people differently. While many recovered at home, others, especially older adults or people with health conditions like diabetes or heart disease, became seriously ill or even died. Hospitals in many countries were overwhelmed. By early 2020, the virus had spread to nearly every country. The World Health Organization officially declared it a global pandemic in March 2020. A pandemic is when a disease spreads widely across the world. The world soon realized that this wasn't just a public health problem. It was going to change life for everyone, everywhere. When COVID-19 started spreading across borders, governments had to act quickly. The first step in many places was to shut down international and domestic travel. Airports closed, flights were cancelled, and people were told to stay home. In big cities, streets emptied out. Restaurants, gyms, schools, and places of worship shut their doors. For the first time in living memory, people around the world were experiencing something together. Many countries entered lockdowns. People were told to leave their homes only for essential reasons, like buying food or getting medicine. In some places, there were curfews. This was an attempt to slow down the spread and prevent hospitals from being overwhelmed. Masks became a part of daily life, and hand sanitizer was found at the entrance of nearly every building. People began learning new words like social distancing, flatten the curve, and quarantine. Healthcare workers became the frontline defense. Doctors and nurses worked long hours in crowded hospitals, often without enough protective equipment. Volunteers helped deliver food and supplies to those in need. Scientists all over the world shared their research quickly, trying to understand how the virus worked and how to stop it. The global response was far from perfect, but it was also a moment of unity. Countries that often compete found ways to share data, medical supplies, and expertise to protect lives. The pandemic changed daily life in ways most people never expected. Many people began working from home. Students switched to online classes using computers and video calls. Parks, theaters, stadiums, and even beaches were closed in many places. Families couldn't gather for holidays, weddings were postponed, and even funerals were held online. Public health rules required people to keep a safe distance from each other. Crowds were avoided, and handshakes were replaced by waves or elbow bumps. Wearing a mask in public became not just normal, but necessary. People had to adjust quickly to a new normal. Grocery stores placed markers on the floor to show where to stand. People cleaned groceries and packages, unsure of how the virus might spread. At the same time, many people struggled with stress, loneliness, and fear. Being isolated from friends and family for long periods was difficult. Mental health became an important issue. But there were also moments of hope and creativity. People started cooking more at home, learned new hobbies, or took virtual classes. Musicians gave online concerts, teachers created fun lessons over video, and neighbors found ways to support each other, from singing on balconies to delivering meals to the elderly. COVID-19 didn't just affect health, it also caused a major global economic crisis. As businesses closed and people stayed home, many workers lost their jobs. In some countries, entire industries like tourism, restaurants, airlines, and retail nearly collapsed. Small businesses were hit the hardest. Some owners couldn't afford rent or salaries, and many companies never reopened. Governments had to act quickly. In many countries, they passed emergency laws to send money to families, help unemployed workers, and support businesses. In some places, people received monthly payments to cover food and bills. Banks delayed loan payments, and rent rules were changed to protect people from losing their homes. But the help was not equal. In richer countries, aid arrived faster and in greater amounts. In poorer nations, many people didn't get the help they needed. Meanwhile, supply chains around the world broke down. Factories closed, goods were delayed, and prices for basic items rose. For example, computer chips became harder to find, which affected everything from phones to cars. Groceries became more expensive. Inflation rose. Even after the worst of the pandemic, the global economy is still recovering, and some people are still struggling to find work or keep their businesses afloat. One of the biggest turning points in the fight against COVID-19 was the creation of vaccines. Thanks to the hard work of scientists and doctors, vaccines were developed in record time. Normally, vaccines take years to research and test, but with worldwide cooperation and funding, the first COVID-19 vaccines were ready by the end of 2020. These vaccines helped train the body's immune system to recognize and fight the virus. At first, vaccines were given to people most at risk, like healthcare workers, the elderly, and people with serious health conditions. Then, as more doses became available, others were invited to get vaccinated. Many countries set up vaccine centers in schools, stadiums, and community halls. Some even had drive-through vaccine clinics. Though some people were nervous or refused the vaccine, millions of others saw it as a path back to normal life. Vaccines helped reduce serious illness and death. Even when new variants of the virus appeared like Delta and Omicron, people who were vaccinated were better protected. Booster shots were later introduced to keep immunity strong. Thanks to these vaccines, schools reopened, travel resumed, and people could gather again. The vaccines were a symbol of hope, proof of what science and human effort could achieve together. COVID-19 has taught the world many lessons. First, it showed that no country can handle a global crisis alone. What happens in one corner of the world can affect everyone. Global cooperation is not just helpful, it's necessary. Second, it reminded us how valuable science and public health are. Strong healthcare systems, clear communication, and trust in experts can save lives. The pandemic also showed how quickly life can change and how important it is to be prepared. Governments, schools, and businesses now understand the need for emergency plans, better internet access, and mental health support. We also learned how important community is. Neighbors supported each other, and families found creative ways to stay connected, even when apart. Technology helped, but human kindness made the biggest difference. Even after COVID-19 fades from the headlines, its impact will be felt for years. Some people lost loved ones. Others missed major life events. Many are still recovering, physically, emotionally, and financially. But we also gained new strength and understanding. COVID-19 reminded us that even in hard times, we can come together, adapt, and find hope. As we move into the future, we carry these lessons with us, not just to survive, but to build a more caring and prepared world. Thanks for watching. If you enjoyed this video, don't forget to like and subscribe.